Calgary's leading cardiac rehabilitation, maintenance and prevention clinic introduces cardiac yoga.
This specialized class is a place of healing, a natural fit for cardiac rehab, maintenance and prevention.
At HeartFit, we see people who have risk of heart disease, but have also gone on to have some sort of heart disease. So cardiac yoga is for all of those people. If they maybe have one risk factor for heart disease, be it high blood pressure, high cholesterol, diabetes, or if they've gone on to have some sort of heart attack or bypass surgery, angioplasty, this is a great way to do exercise and stress management at the same time.
Sean Furcho suffered a massive heart attack last year. He visits the heart clinic 3 times a week for rehabilitation and is a proud member of cardiac yoga.
Since I started this, I definitely am a lot better shape than I was a year ago before my heart attack. There's no doubts about that. Following strict things with my doctor, I've lost quite a lot of weight. I still need to lose a lot more, but things come, right?
Reducing any risk factors of heart disease can reduce the overall risk of having a cardiac episode.
It is really important for stress reduction, which is really key for all of these people in this class. It's an important component of opening the chest. Anybody who's suffered any kind of heart trauma usually is a little bit more closed off or tightened through the chest, so we really focus on opening up the chest and getting the shoulders back and lifting the heart.
Cardiac yoga is similar to regular yoga. However, there are some specific differences.
Anything where the head is going to be below the hips, such as downward dog, which is a key component to a lot of regular yoga classes, but in this class we don't do downward dog, so we replace it with other things like being on all fours, anything where we can keep the head in line with the pelvis.
Roll the shoulders back, lift the chest.
According to the Heart and Stroke Foundation, 7 out of 10 Canadians are at risk of heart disease, and the best thing you can do for your heart is exercise. For SHAWTV, I'm Lisa Wolanski.